We can understand if someone says we need some time, we're working towards it, but we need time for full implementation. What we will not countenance is someone saying, I will not obey the law.
Halkitis also putting his foot down as it relates to pharmacy operators withdrawing their services from the public on short notice. The association advised its members to temporarily close their doors starting today to avoid being in discompliance with the law and subsequently paying fines. This as the changes to the price control list is being enforced as of today.
We would be fully within our rights to have enforced from the 17th of October. Right. We said that we will not enforce, expecting that there, when you say consultation, we expected there to be a move towards implementation so that when we do come to enforce, we may be able to say there's not complete implementation, but there's an effort being made.
Meanwhile, members of the association gathering outside the office of the Prime Minister to voice their concerns about the changes to the price control list. And according to Association President Shantia McBride, there was a lack of consultation.
When we met with Minister Halkitis, we were under the assumption that now our consultation period begins. 2 working days later, I would say, he came back and stated to the public that he's enforcing this act, this amendment, November 1st. So at that time, our recommendations did not even reach government yet.
But to that, here's what Halkitis has to say.
That does not mean that we stop or we freeze, because that is the danger when we use this word consultation. And you see what happens. We get in this seemingly endless back and forth.
McBride, however, maintaining that the association was blindsided by the enforcement. And at this point, she's concerned about the impact it's going to have on the pharmaceutical industry.
Based on those margins, we can't afford to close tomorrow. So if those margins are to continue, even if they're saying for 3 months, some of our small pharmacies may close. And we can't have that for big or small pharmacy right now. And if a small pharmacy closes, that's jobs, that's maybe 1 or 2 jobs. But a big pharmacy, that's possibly 10 to 20, wholesaler, much more.
Barbara Wilson, director of a local pharmaceutical wholesaler, is also suggesting that pharmacies are being targeted.
The government is one of the biggest procurers of drugs. They have already put in place a way for persons who cannot afford drugs to get them. You can get drugs free at any government clinic and any government hospital. And then there's the National Insurance Prescription Plan that many elderly people and persons who fall into the category can achieve. So I'm not sure why we are going this route after the pharmacists and wholesalers have already stretched themselves so much to coincide with these demands.
But here's government's explanation as to why they're moving forward with the enforcement, despite both parties not being on the same page.
The public needs relief. And, as I said earlier, number one, the amendments were made October 17th. I met with in the case of the pharmacists, Friday before last, right? They sent me a letter. I understand it was supposed to come to me on the Monday. It got to me on they were supposed to send it on the Monday. They sent it on the Thursday. Be that as it may, you get the letter. You need time to understand it, consult with your technical people, consult with other colleagues before you give a formal response.